lot of my patients, my big thing is, it goes with the team aspect of, I really want my patients to have the right care and course of treatment at the right time with the right practitioner. And sometimes we have to, let's go to the medical doctor, get that antibiotic to kill that infection that you have, and then come back to me and we'll recolonize your gut and make sure your nervous system is in check. And it's a team effort, but it's all the right care at the right time with the right practitioner.
Exactly.
And sometimes that's not me. Sometimes I refer them out, and that's okay, because it's not about me taking charge of anyone's health. It's about getting these people on the right path to heal themselves.
Hi, everyone. Nicolette Richer here, your host of the Eat Real to Heal podcast, where we bring you stories of healing from healing heroes and wellness warriors who have gone through the trials and tribulations, the learnings, the discoveries, everything that really entails choosing the right path for your health. We bring you their stories so you can learn from them, so you don't need to reinvent the wheel. We also bring you the knowledge and the science from medical doctors and other healthcare practitioners and the scientists that are out there who can shed light on all of the missing information that is all mumbled and jumbled on the internet, making it hard for us to know what step forward to take with our health. So thanks for being here with us. It is right now, when I am recording this intro for this show, it is May 12th, and we just received word in British Columbia that there is going to be opening up of the province. We can gather in groups of 6 and not more. But as the world starts to open up from COVID, it's really important for people to understand that they still need to take care. And yes, you're going to be interacting with people. So for sure, continue to wash your hands as you probably should have been doing prior to COVID. Continue to cough into your elbow as you should have been doing even before COVID. But not only that, remember that food is medicine. Remember that sleep is medicine, that the right mindset is medicine, and continue to practice those things vigorously, rigorously, just as you were probably doing while you were in isolation. But don't let that slide just because we've been told by our governments that we can go back to potentially not business as usual. It's going to be a new normal, but we can forget the gifts that we've gained during this time, and you don't want to lose those daily practices, daily habits that you have been starting or wanting to start. You want to continue with that more than ever, because of the fact that there's always going to be another COVID. There's always going to be another catastrophe. And the world is still battling climate change. Our planet is still in potential peril if we humans don't change our behaviors. So we've been given this gift of time over the last 8 weeks. So let's not squander it by going back to, partying at the lakes and, consuming foods that, we normally wouldn't have consumed. If you developed cooking techniques, share those cooking techniques on how to cook plant-based whole foods with your friends, with your neighbors, with, strangers even. Think about the work that you want to be doing in this world and ask yourself, is it meaningful work? Is it work that is actually going to make a difference in this world? Is it work that is giving back to humanity, back to our societies, back to the planet, tenfold, twofold, fivefold? It doesn't matter what it is, but you have the opportunity, you have the choice, you have the ability to make decisions that are going to better the lives of everyone and anything around you. And that even might mean benefiting the pavement, the stone, a building. It could be benefiting a tree, the soil, the grass that you walk on. It really could mean benefiting anything and anyone. So go out into this world as, all the things that have been holding us back from connecting with others as the world opens up. go into this world wanting to be of service to others as you are of service to yourself. So, what I mean by that is, and I know that I could be the biggest hypocrite when it comes to this, but we need to put the life mask, the oxygen mask on ourselves. For sure, we need to do that first. So make sure you are eating well. Make sure you are thinking well. Make sure you are living a wholesome, good life, but also look to the person beside you. It could be your child, your partner, your parent, your grandparent, your neighbor, but see how you can help them put the oxygen mask on themselves as well. It is so important that we do that, that we continue to look out for each other as we go back to, our world as maybe we used to know it, even though I 100% know it won't be that, but it might feel like that as you jump back into the rat race and keeping up with the Joneses, and know that it doesn't have to be that way, because really the way you want to live your life, it is 100% the direct result of the values that you hold, the principles that you have, the vision that you have for your existence on this planet. It's really up to you to create the life that you want to have. So go out there and start doing that with the thoughts that you have right now and the actions that are going to stem from those thoughts that are circulating inside of you. So, as we move forward into this podcast, I just want to say how excited I am to be able to bring on Dr. Brandi Benson onto our show. I have been doing chiropractic care, as you'll learn, since I was in a very terrible car accident with my husband when we first met. And if it wasn't for chiropractic care, there's no way I would be here today delivering these, stories of hope and healing, bringing on these incredible guests like Dr. Benson, if it wasn't for chiropractic care. So, with all the clients that I've been able to help over more than a decade of doing work in regenerative medicine and food as medicine, I have come across so many people who don't know what chiropractic care is. They don't know how it can benefit your body and your mind and your soul and your spirit. They don't know that chiropractic care is safe. They don't know that it's been around longer than medicine. They don't know, and they don't understand that you can use chiropractic care for your babies. And instead, I see so many mothers suffering with colic and with constipation in their babies and suffering from all of these things that we're being told by our medical doctors, can be treated through medicine, when in fact they can't, because if structurally your child and your baby is not aligned, it's going to be really hard to support your baby in other ways. And so it doesn't have to be that way. If we can get the message out there that chiropractic care is actually a practice with evidence-based science and medicine around it, that it's been around longer than our current existing medical practice as we know it, and our existing medical system as we've been told that it is supposed to be that way, well, you might actually then decide to give chiropractic care a try. And you can stop saying things like, well, everybody told me I should go see a chiropractor, but meanwhile, you don't do anything about it because you have this worldview about what chiropractic care is, which might actually be incorrect. So, as we dive into this podcast, please know that chiropractic care is safe and it is effective, and it is literally the difference between chronic pain and no pain, the difference between acute pain and zero pain, the difference between a healthy brain and having a brain that is not functioning optimally because of the fact that your neurological system is not connecting. Your nerves are not connecting from the brain to the body in the way that they should. So, learn as much as you can. Don't just take it from myself and Dr. Brandi Benson, who's about to be on the show here. go out there and experiment with it. You can find a chiropractor that is incredibly gentle, that, doesn't use too much manipulation. They have other techniques that, you might be more comfortable with. You don't have to jump in to having your spine manipulated or your neck manipulated, even though I love that because it gets me the fastest, best results that are lasting. I don't have to go to my chiropractor every week. I don't have to go for multiple appointments. Sometimes I only see him once a year, once every 2 years. Obviously, if I was more proactive with my health, I'd probably go more often. But, you can start really gently and then work your way up. My sister-in-law is an amazing chiropractor in Quebec. She works with the Taekwondo team. She works with the Olympic team. She works with athletes all over. She teaches at the chiropractic school. And you might think I'm biased because I have a relative who's a chiropractor, but I mean, ultimately, my healing hero story should inspire you to go get chiropractic care if you've never done it before. And of course, Dr. Brandi Benson's story will also inspire you to start bringing in chiropractic therapy and care into your family's healing journey as well. So join us today as we bring Dr. Benson's knowledge and skill set to the table for you to learn about. You can contact Brandi at her chiropractic clinic, which is called Myalign, and that's at www.myalign.com. She's based out of Kansas City. I wish she was based everywhere if we can clone her, but that's not the case. And it's okay because there are incredible chiropractors in every city across the globe. So rest assured, you're going to find somebody good to care for you. So join us today. Excited to have you here, listening to Dr. Benson's show here on the Eat Real to Heal podcast. And of course, you know what to do afterwards. Share this podcast with others. If you've been trying to convince your relative or your friend to go see a chiropractor, this is the show to share with them so that they can start healing today, in addition to obviously all the healing that they're doing with their food in their kitchen and with their mindset in their yoga practice or in their meditation or whatever other form of alternative healthcare that you are bringing into your life, which should be actually called mainstream healthcare, as I say that out loud, because everything you learn on the show with Dr. Benson, everything that you learn on the other podcasts with all the other guests that we bring on, really what they're sharing should be mainstream. It should be knowledge as we know it and as we practice it every single day, because it is truly the medicine that heals us, in addition to obviously all the great medical care that is available to us through our medical system when it comes to acute care. So that care when you're in a, car accident, when you have an acute disease and so on. But for every other day, for the majority of our lives, we need that chronic, we need that consistent care that comes from, sleeping well, eating well, exercising, thinking good thoughts, meditation, chiropractic care, physio, massage, working in our gardens, communing with our loved ones. All of those other practices need to be brought into our lives on a daily basis, from day to day, week to week, year to year, because that is the state that we're living our lives in. Most of us are not living our lives in an acute situation, but we can implement all of these things that we're talking about so that you don't have to live your life in any chronic health states and with chronic health conditions. So go out there and share this podcast. Thanks for being with us. Thanks for safely entering into our COVID world well and with intelligence and with care for others, despite what the government is saying, whether you can gather in groups of 6 or more. Just do it mindfully, do it intellectually, and do it with grace. Okay, bye everyone for now. We'll see you at the end of the show. Hi, everyone, and welcome to our Eat Real to Heal podcast. I am your host, Nicolette Richey, and on today's show, we have Dr. Brandi Benson, otherwise known as Dr. Brandi, to all the kids that she works with and all the families that she works with. So Brandi is a chiropractor, and I'm so excited to finally have a chiropractor on our show that is going to be able to teach you why chiropractic care is vitally important for the maintenance of health, for also the reversal of so many conditions, and for optimal living as well. Brandi, welcome to our show.
Yeah, I'm excited.
I'm very excited to have you here. So, just for everybody who's listening, how I got to know Brandi is that I was speaking at a wonderful event, the Who is Carter Foundation event for The Brain is Possible. And Brandi, you were there. You had a night out and you looked
Yes.
amazing. And
Thank
I
you.
got to sit with you at our table and I got to learn some amazing things about you, like the fact that you have two sets of twins.
That's right.
Yeah. And how is that? Like, I know you are, I mean, this amazing mother, like all mothers are really incredible, but you're doing it like 4 times over all at once.
Yeah, it was a surprise to us to have 2 sets of twins. It was not planned. It's just how we had our kids, and definitely surprised. And I tell everyone that I meet, they're like, "Oh my gosh, you must be super mom." And I tell them being a parent is a journey in itself, and everyone it's the hardest job, but it's the most rewarding job, no matter how many kids you have. So, it's
Exactly.
so much fun. So
And so with your children, we're going to get into chiropractic care and how you got into chiropractic care, but how old are they now?
they are 5.5 and 3.5. And my big girls, I have 2 girls, Lila and Micah, and they're in kindergarten this year. And then my younger set is a girl and a boy, Aster and Wade. And they are, doing some preschool stuff at home. We have a homeschool program that we work on with them at home, and just learning and growing and playing and just enjoying life. So
That
healthy.
is That is amazing. And do you have a partner that supports you? Do you have a nanny, or how do you manage having 4 kids under the age of 6 at home while you are busy working and doing all of that?
Yeah, I have an amazing supportive husband. Also has a full-time job, but our schedules balance out with each other that someone's home for dinner every night, and we're all home for bedtime. And then we also have a wonderful nanny that has been with us for 3.5 years now, and
Amazing.
we've known her for about 4 years, and she's just part of our family now, and the kids love her and we love her, and
Amazing.
she is just a vital part of our family. So,
That is amazing. And how long have you been doing chiropractic care for? When did you
so
first
I
start
am
getting into this?
almost 7 years
Mhm.
now. And I have, since I graduated, I joined a practice with my now partner, Dr. Kiza Shine, her practice focused on mommies and babies. And I wanted to do kids, so I came right out of school and started working with kids and haven't looked back since. So it's been a fun 7 years, and I've learned a lot and gonna keep going. So.
And what ultimately sent you down that road of chiropractic care versus any other, career or any other health career?
Oh yeah. I grew up in a very medical based family, and my dad was a paramedic, my mom's an EMT, and when you turn 18 you go to EMT school. So I worked as an EMT through my undergrad and grad school years. And when I was working as an EMT, I could see how unhealthy and sick people were, and they were just on so many medications, and um, they weren't getting any better. And I was seeing in a very like short span of time with emergency situations, but I saw the same things over and over and over again, and how unhealthy our population was. And I always wanted to be a doctor, but at that point in my life, I didn't know what kind of doctor I wanted to be. And so with the unhealthy society that we're in, I wanted to um, pursue something that I wasn't going to be just adding to that problem.
Mhm.
So I started looking into more holistic um, roads, and chiropractic. I've always been a chiropractic patient growing up, even in a very medical based
Oh, wow.
practice family, but it was always for like sports injuries and pain. But once I started really diving into it, it just opened up a new world on how the body can heal itself with the right foods and the right air and the right thoughts and the right movements, and it really resonated with me. So and then I changed my path and surprised my whole family, and went to chiropractic school.
Wow. And for chiropractic school, so if you can just explain to individuals, and the reason why this podcast is so important to me is because um, with all the work I do with clients who have cancer and chronic disease, and often when we do this one exercise, it's called building your whole health team, and
Mhm.
where we say, okay, what are all the modalities of health care that can support you? So it might be nutrition, or an optometrist for eye care, or an endocrinologist for hormone care, or, there's so many different health practitioners, but there's also traditional Chinese medicine and acupuncture, and then there's chiropractic care and physio. And people often, I recognize from doing this work with thousands of people, that they're really hesitant to put down a chiropractor, despite the fact that chiropractic care is actually older than our current Western medical care. And so when it comes to chiropractic, I can't even remember what my original question was, but let's riff off of that for a little bit, because I really want people to understand. Um, oh, and I now remember what it was. It was talking about when you go to school, so chiropractic care and medical doctors who study, traditional
Right.
Western medicine. I mean, you get the same original 2 years of science, correct?
Yeah, for sure. Yeah, and we get all of the, anatomy and physiology. I mean, we dive into neuroanatomy like really far, obviously, since we're working with the nervous system. And then, we go into the adjusting techniques, and there's so many different techniques to get the nervous system back in balance. But we do learn. Um, I mean, it's a 4-year postgraduate degree, just like a medical doctor, and then you can further specialize from there. And I've chosen pediatrics as my focus. But we can. A lot of people think chiropractors just for musculoskeletal pain, and a lot of chiropractors, that's what they do. And it's a great addition to anybody that's having musculoskeletal pain, because
Yeah.
that's chiropractors are the doctor for that. But also, the real philosophy behind chiropractic is um, that the power of the body can heal the body if we give it the right things, and support their nervous system, because your nervous system controls everything. And
Mhm.
so that is what kind of makes chiropractic stand apart from the traditional Western medicine, is we're really affecting the nervous system. And there's been some really awesome research that's coming up about how, like, the power of an adjustment and how that actually affects and changes the nervous system, which is some really cool stuff coming down the research pipeline.
Which is amazing. And we need that as well. And especially for the medical community, to have doctors say, hey, I'm going to refer you to a chiropractor, as opposed to not referring to anybody or just thinking that the pill
Right.
is going to be the solution. Like, we need more medical doctors to understand the power of chiropractic care. And this is what makes me so sad, is that I love the history of chiropractic care, because of the fact that, it is actually longer. It dates back further than our existing medical system. Can you talk a little bit about that and share the story of chiropractic care with people?
Yeah, so I mean, chiropractic, man, I mean, you can go back to like Hippocrates, and it's like food is medicine. And so, um, being able to, place our hands on patients and having that a physical connection is, I think, a lost art in a lot of traditional Western medicine
Mhm.
um, modalities. And um, just balancing the energy. And chiropractic has been under the Wilkes versus AMA case. You can always talk about that, about um back in the day, the AMA, the American Medical Association, was trying to shut down chiropractic, and we as chiropractors currently, we're still kind of fighting that battle to get the acknowledgement of what we're doing, can complement and have such an impact on patients' lives, just like Western medicine can and does as well. I think there really needs to be a balance, and I think people are becoming a little bit more open to these more holistic avenues as we learn more, and as we learn more about holistic avenues of healthcare, but also as our population just gets sicker and sicker, and people are really trying to figure out, we can't keep going down this road. And it's a really exciting time for chiropractic care, to kind of take that next step into being more of a part into the team aspect. And I'm really big on having a good healthcare team for my patients as well. And I've been able to get good relationships with other practitioners, healthcare practitioners in our area, with physical therapists and endocrinologists and GI doctors. I work with a lot of GI doctors and ENTs and I work with some dentists as well. It's just, you have to build that team, and it's really an exciting time for me that, we have the research and we're having the results, and being able to show that is a really cool time for us, to kind of be part of those healthcare teams.
Yeah, no. And it's really important that, all practitioners are really looking to other practitioners to say, hey, how can we serve this patient in the
Right.
best possible way? What tools do you have that would also help them? And what tools do you have that would also help them? And, people bring these tools together because the body is complex. At the same time, it's actually pretty simple what the body needs. It needs nutrition, right? It
Yeah.
needs to be able to detoxify properly. It needs
Right.
to be able to be in alignment structurally, muscularly, and if that's even a word. And it needs to have, it needs water. It needs, there's so many different things that it needs. And as
Yeah.
long as the body's getting that, it actually operates really well.
Really easy. Yeah, it
Yeah,
does. It knows what it's doing. Um, I
exactly.
tell I tell a lot of my patients, my big thing is, it goes with the team aspect of, I really want my patients to have the right care and course of treatment at the right time with the right practitioner.
Right.
And sometimes we have to, let's go to the medical doctor, get that antibiotic to kill that infection that you have, and then come back to me and we'll recolonize your gut and make sure your nervous system is in check. And it's a team effort, but it's all the right care at the right time with the right practitioner. And
Exactly.
sometimes that's not me. Sometimes I refer them out, and that's okay, because it's not about me taking charge of anyone's health. It's about getting these people on the right path to heal themselves.
Exactly. And with the patients that you see, they're obviously bought into the concept of a chiropractor. Let's talk about the patients in the world who are totally against chiropractic care, despite the fact that they've never even had it, but just from what they've heard in the media.
Yeah.
Because this is the part that makes me so sad that, we have Vioxx. It's a, drug that's being prescribed in North America, and it kills about 100,000 people a year. I believe there's, lawsuits left, right, and center, against this drug company for people who've died, and or had heart attacks as a result of this arthritic drug. But meanwhile, in chiropractic care, yes, in any modality in the world, there are going to be injuries that come from it. So we do have to acknowledge that there have
Right.
been,
There's
but
risk with every treatment. Out
exactly. But within chiropractic care, if you actually look literally through all the literature, through all of, it's very rare that this happens in
It
chiropractic
is.
care.
Yeah. And um there's always going to be a bad doctor of medicine. There's always going to be a bad chiropractor out there too. But the the risks are pretty rare. And if you get down to it, our malpractice insurance is significantly lower than a medical doctor, and that just shows how safe it is. And even for infants, because I see kids and people are like, how the heck are you adjusting a kid? Well, it's different with kids. I'm not, cracking their backs and
Yeah.
things like that. It's we're giving their bodies the input that they need and to restore function. But yeah, it's crazy how people are so easy to go to a pill
Yeah.
and not try something else. And with chiropractic care, there's a lot of things out there of once you go to a chiropractor, you have to go all the time. And I mean, as someone who loves chiropractic, I don't go every week as a chiropractor myself, but I know that my body functions better when I do. And so when people start to have that realization as they start going to a chiropractor, they're going to continue to go. And it's not that they have to, it's because they know that their body is functioning at its most optimal place by going to the chiropractor. And and our care plans are very much tailored to the patient and what their body needs, and it's not a 3 times a week for forever kind of thing. It's it ebbs and flows depending on what's going on in their body. So yeah, it's really interesting to you go to the dentist all and as part of your health care you go to the dentist to make sure your dental health is good, go to the chiropractor and make sure your spinal and nervous system health is good.
And that took me a long time to learn that lesson. Actually, I only just learned it about 2 weeks ago when it comes to chiropractic care, because, and I'll just share my story about how I first learned about it. So I used to walk my dog in the woods, and it was amazing. Every time I'd walk my dog, I'd always see this really lovely man. He was probably in his 60s, and he had this great dog, and our dogs would play together, and we'd always have these incredible conversations. And then one day, I said, "Oh, my fingers are frozen, like my ring finger and my middle finger." And he goes, "Oh, that looks like you have Raynaud's." And I was like, "Well, I didn't know what that was." I was about probably 21 at the time. And he goes, "Oh, you should probably like consider seeing a chiropractor for that." And I was like, "A chiropractor for this? Like how are they going to be able to help me with this?" And he started to tell me about how when he was a little boy in Belgium, where apparently a lot of families use chiropractic care as their first line of defense.
Mhm.
Like, you go to a chiropractor before you go see a medical doctor, right? You get your nervous system aligned. And if that doesn't heal the body, then you'd go to the doctor. So he told me this, and I was really fascinated by this. But as a little boy, he had suffered so painfully, extremely, from eczema, depending on how you say it, for different people out there. And he was covered from head to toe to the point his skin was cracking, oozing, bleeding continuously. He'd be in the hospital wrapped up in bandages, and none of the medications that they gave him were helping. And a friend of the dad said, "Well, I think he needs an adjustment. He needs a chiropractor." And this was the family's first, foray with a chiropractor. So the dad took his son, or the chiropractor came into the hospital, did an adjustment, and within a week, his eczema was healing incredibly well. And it went away entirely. And the chiropractor said, "Hey, when he's about 9 or 12 years old and going through puberty, he's probably going to have a growth spurt, and that can take his structure out of alignment. And and if it comes back, if you notice this tiny, tiny patch, then, just bring him back and we'll do another adjustment." And that's exactly what happened. Had another adjustment. And this man has been eczema free for his entire life now,
Yeah.
since then. Right? Like, isn't
Yeah,
that amazing?
it's so cool. It's
I
so
know.
cool.
But you're like, yeah, I see stuff like that all the time.
Every day, that's what I do. It's so cool. And I mean, it really so chiropractic, and just to the nitty gritty, is we want to make sure the bones in the spine are moving well. And because if those joints in the spine, the vertebrae, are not moving well, it causes um, the sensory input into the spinal joints there. You get a dysfunction at the joints, the input to the nervous system, you get pain, you get inflammation, those joints aren't moving, the body's trying to protect it. That's going up to your brain, and the brain's not getting the proper sensory information, because those joints should move freely, right? And move when they're supposed to move. With the subluxation, the joints aren't moving like they're supposed to. And so you're getting disafferent information going up to the brain. So it's not the proper information going up to the brain. And then the brain has to interpret that. And the more subluxations you have, the more misinformation, disappropriate sensory information is going up to the brain. And then the brain has to have a response to that. And oftentimes it's pain, and that's why people come to the doctors or come to the chiropractors. Sometimes the brain will respond with an immune response like eczema, or causing GI dysfunction like constipation, or even enuresis and bedwetting, or headaches, all those different things. If the brain isn't getting the right information because that spine is not moving correctly, you're going to have an improper response, like motor response. And so the adjustment restores the function, the movement at that joint, so that those nerves at that level are getting the proper information. So it's really cool. And a lot of the kids that I see aren't coming in with low back pain.
No.
So that's another thing that people are like, what are you seeing in kids? Because they're just born. Like, why do they need to come to a chiropractor? They don't have back pain. Well, yeah, they do. They just they express it differently. Those joints
So
are
what are the things that you're seeing with the kids? Because I'm imagining you're seeing things like projectile vomiting,
Yep.
right? You're
Yeah.
seeing colic.
Yep.
Yeah. What are some other things that you're seeing in the kids these days?
Constipation, gassiness, just overall discomfort. It, those colicky babies that just don't want to be held and cuddled. Babies should be want to be held and cuddled, and a lot of these babies are just in a lot of pain, and they express that with the fussies, the gassies, the spitties.
Yeah.
We see a lot of kids with nursing difficulties, tongue tie, lip ties. If the function in the mouth isn't right, and that because it's restricted by a tie, we have to that's where the team approach comes in, and we work with lactation consultants and dentists and ENTs and get that oral function better, which gives you proper sensory information, and then the rest of the body works better. So lots of lip tie, tongue ties. As the kids get older, their little bodies are under stress. Being born is a stressor. It's hard work to be born for everyone involved.
Yeah.
So that's definitely a stressor. Learning to walk, hitting those motor milestones is so important for the brain. And so we tell parents that even if their baby is doing well, we want to check them regularly, because we want to make sure that their movement patterns are correct, so that their brain is getting that proper sensory information. And we don't want them to miss any milestones, because that's so important for brain development and primitive reflex integration and sensory integration. So we check kids all through that first year, and a lot of parents are totally on board with that. And we don't have things like we resolve the colic, the torticollis, the constipation. We got happy poopers, happy sleepers. The kids are crawling and walking when they're supposed to. And if we get a speed bump of, they're crawling with one leg kind of dragging behind, we can help their bodies correct that and give them the support they need to integrate those movement patterns correctly for their brain development. It's just, it's really cool how one little thing can affect so much in development.
So much, everything, right? Because if their digestion is off, then that affects their ability to walk and talk and crawl and all of those things as well. And they're learning, there's learning difficulties that stem from having their digestion not be healthy, which brings me to, did you see the movie Miracles from Heaven?
No, I haven't.
Okay. So I'm just going to recap this for anybody who is out there that did see it. I want to see if you can switch your thinking about this movie, because when I saw it, so it's about this little girl who they find when she's about 8 or 9 years old, and it's a true story. She's 8 or 9 years old, and she all of a sudden can't eat anymore. She keeps vomiting, and so every food that she puts into her body, she projectile vomits. So this little girl's obviously losing weight, and she's in pain. And then they try and look into what's happening, and then eventually, like, one of the best specialists in all of the United States sees that I can't remember the diagnosis, but basically the bottom half of her stomach becomes paralyzed, stops working. And so they try and treat her with everything. I think like even chemo drugs, like absolutely everything to try and get the function back. She has a feeding tube down through her nose that passes through directly into her gut, because it has to bypass the stomach because her stomach doesn't work anymore. And of course, this little girl she's set to die. The doctors have tried everything. There's nothing that they can do. So at the end of the movie, one of the big things is there's a tree on the property that this little girl loved to climb, and she couldn't climb it because now she's got a bag and she's got this feeding tube, and she's like, she's weak. So her older sister says, come on, as your last dying wish, I'm going to take you up this tree to climb this tree. And she does. This sister brings her little sister up there, and the family doesn't know this, but the tree's hollow, and this obviously the sister doesn't know this, and the branch breaks and she falls inside the tree head first and falls like, I don't know, like 40, 50 feet down. Like, it's a long fall. And for some reason she doesn't die and she doesn't break anything. And it takes them hours and hours and hours to like cut open the tree and get this girl out. So of course, the mom is so angry at the older sister for bringing this like sick little kid up the tree. But then what happens over the next couple of days is that all of a sudden the little girl is like, I'm hungry. And she wants to start eating. But her belly, which was blown out like she was 9 months pregnant, okay, so distended from everything that's happening in her gut not working, all of a sudden her belly starts to shrink and shrink until it's flat again. And this little girl is eating like a horse, or like a cow or whatever, eats like a lot of food, like one of my hungry dogs. And this little girl is all of a sudden like cured. Right. So it's called Miracle from Heaven, because obviously the family is like, God saved my child. Right. But I'm like, I don't think God saved your child. I think you had a chiropractic adjustment.
When
when she fell, it did something to her spine, which reestablished the connection, which undid the paralysis to her stomach. Now, I could be completely wrong here, but I'm going to tell you another story, and then I want to see what your interpretation of this is. So you have to see this movie, by the way. Like, every parent bawls their eyes out. And this movie is true. Like, they have the family that comes on after the movie to say, yep, this is exactly what happened. So I was in a bad car accident when I was about 21 years old. So after learning about fixing my Raynaud's with a chiropractor, I was in a bad car accident, and I was severely constipated, like couldn't go for days. And I also had this gag reflex where if I smelled anything off, like it would just cause me to gag. If I looked at something gross, it would cause me to gag. And I'd never had that before. So I'd read about this chiropractor in the paper, and his story just seemed very compelling. So I went and saw him. I looked him up and went and saw him. And he said, tell me what's happening with your body. Like, every little tiny thing that you think is not associated with your back pain, because I had back pain and neck pain from the car accident. And I said, well, I am really constipated, but every doctor told me that I should just take Metamucil. Every physio told me to go back to my doctor and get medication and take laxatives. Like, nobody was able to help me. And he's like, oh, don't worry about that. We can fix that. I was like, okay, sure you can, buddy. And so then I said, I have this gag reflex, which started as well. And he showed me on a chart, he showed that he had up him as well. And he said, okay, well, this is where all the nerves connect to your throat and how they function. And if any of this is, compressed, well, then you're not going to get that nerve signaling, and you can trigger a gag reflex. So he showed me on the chart, he showed me the nerves and the blood vessels and the bones and the muscles and the joints and everything, how it's all connected. And I was like, okay, sure. He adjusted me, and I went and had the biggest poop of my life just about 10 minutes after he adjusted me. And I never had the gag reflex again. My constipation was literally cured from that one adjustment, which was amazing. And I mean, he did exactly what he said he was going to do. Right?
Yeah. Yeah. It's they call me the poop doctor here a lot because I
Dr. Brandi, the poop doctor.
it happens. And like I have kids that they're like, I'm here because I haven't pooped in a few days, Dr. Brandy. And I'm like, okay, like let's get this going. And they stop by the bathroom on the way out. And like sometimes even just like coming to the office is enough energy for them to even have a big blowout. But which is really funny. But yeah, I mean, if your bowels can't communicate to your brain to say, let's get this out, there's dysfunction there, and there's a roadblock in that nervous signaling. That sensory information is not getting where it's supposed to be, and you have dysfunction. One of the examples I use a lot in practice is bedwetting.
Yeah.
And the nerves that go to the bladder are lower back. They're kind of right in the same area. And if we have a subluxation there and we have dysfunction at the spine, in the lumbar spine, when you go to sleep, the bladder gets full. In a normal person without bedwetting, it sends a message up to the brain, say, hey, buddy, let's wake up and go to the bathroom. Well, when you have subluxation and dysfunction in your nervous system, the bladder gets full. It's sending messages up to the brain, but it's getting lost somewhere along the road, or it's jammed up in traffic. And the bladder gets so full and doesn't wake you up. You're not getting the message to wake up. And so your bladder just goes. And
Yeah.
so by doing a chiropractic adjustment, restoring that function at the joint, removing those roadblocks on the nervous system highway, allows your bladder and your brain to talk properly. And it's the same way as like as we learn to potty train, you're developing that interoception of like knowing what's going on in your insides, and your brain can now communicate to your bladder and say, hey bladder, you got to hold on until we find a bathroom.
Yeah.
And that sense. And that's all sensory information. Sensory input equals motor output. And that's really all our body does. Like
Yeah.
everything you put food in and how it's digests, it's it, we have to have food going into our stomach, and our stomach is activated by that food being there. The sense of food being in our tummy allows our body to secrete different enzymes and stuff to help digest your food, and then it goes through your bowels. And the same with like hormone production. If you're in a state of fight or flight, your hormone production is going to be shifted, and you're going to be running on cortisol all the time and burn out your adrenals. So yeah, it's really cool how one little adjustment can just change something so quickly.
So quickly. And especially like the bedwetting topic is so important because of the fact that for children, right, like a lot of these kids are suffering from bedwetting until they're like 13, 14, 15,
Yeah.
16. And it literally could be just one adjustment, two adjustments that you need to help their, just relieve that pressure in the back and get the communication happening. And all of a sudden they're waking up and able to go, right?
Yeah.
And
And we find oftentimes that their bodies can handle a certain load of stress, like, playing outside and falling on their bottoms, or just being kids. And they get into a routine that, every 4 weeks, every 6 weeks, they know if they don't get adjustment, they're going to wet the bed, just like the eczema. Like our bodies can handle so much load, so much allostatic load. And our bodies are trying to maintain that homeostasis, that balance. And the more stuff you put on your teeter-totter, the allostatic load, it's going to make that homeostatic balance imbalanced. Right. I like to tell, I do a lot of analogies, and I tell parents everybody has a stress bucket. We all want a really big, empty stress bucket. But if we're the stressors of life, everyone has stressors, that allostatic load, what we're breathing, what we're eating, what are we putting into our bucket? Are we sleeping well? All of those stress balls come into our bucket. And if our bucket is too full and we can't maintain that balance, that's where symptoms present. And,
Exactly.
and so our goal is to let's try to remove some of those stress balls. Let's try to build your bucket bigger by allowing your body to not have to have fire alarms going off all the time because you're eating something that your body is sensitive to and immune response all the time. So let's calm that down so you can grow your bucket bigger and allow your body to handle the stress, because we're all going to have different stressors in our life. In chiropractic, we go on the three T's, the traumas, which are just physical stressors, like sitting in a chair all day at a desk job, or learning to walk and falling on your bottom a lot, or car accidents, those obvious stressors. But the text neck of, looking down at our phones all the time,
Yeah.
those are physical stressors that are going into our bucket. And then we have toxins, and those are what kinds of things are we putting on our skin, in our body, what are we breathing in. I also like to think of toxins of what good things are we not giving our body? Like, are we missing some nutrients? Are we on drugs that are depleting our nutrients? That all kind of goes into your toxic stress balls. And then thoughts, mindfulness is becoming more mainstream now. And, we want to have a good emotional balance too, because we want to make sure our neurotransmitters are balanced, which requires good gut health.
Yeah.
And we want to be able to handle those emotional stressors, those thoughts and emotional stressors, and keep those in balance as well. So you get those emotional stress balls. And a new one that we've been talking about, my colleagues, is the fourth T, which is technology. And we're getting a lot of technology stress in our lives, and how video games and television and like blue lights on our computers, like all of those technologies, EMFs and all those things, those are technology stress balls that are going into our bodies. And our brains don't really know what to do with that. And we're seeing some really interesting brain changes that we've never seen before because of the technology that we use in our world today. So we have those four types of stress balls in our bucket, and they're always going to be there. We're always going to have something in there because we're not perfect beings, right? But we need to be able to, handle a fall and not be miserable from it. Like a toddler, they're able to fall on their bottoms and they get back up and keep playing, whereas as adults, our buckets are a little fuller, and if we fall down, we could be aching for days, right?
Yeah.
And so it's all about that balance of homeostasis, and how many stress balls do you have in your bucket and how big your bucket is. And that really resonates with parents. And I explain this to kids too, and they get it. And they're like, Dr. Brandi, I went to a birthday party and I had some toxic balls and had some Cheetos. And I'm like, it's okay. Like, we need to be able to have things in moderation and be able to handle it.
Exactly.
Yeah.
No, I think that that's a really big point, is that, with the work that we do, because everything we do is through food, right? So
Right.
nutrifying the body through food. And of course, there's some supplements you do have to take that you can't get those nutrients through food. And
Right.
then, of course, detoxification is a big part, but that's, the byproduct of being able to have a body that's functioning optimally, able to start detoxifying, and we assist it.
Mm-hmm.
And and definitely stress gets better as a result, or not stress, well, yes, that's the point that I was going to make, but sleep gets better as a result. But what I love is the resilience that comes when your body is functioning optimally. So when you do all the nutrition, and then when you manage your body with the chiropractic care, or the physio if you need it, but these other modalities, right, to get your body in amazing health, then all of a sudden these massive life stressors come, like, for example, you can go and do a 50K race, or if you are in a car accident, it doesn't all of a sudden trigger an autoimmune disease shortly after, versus the person who enters into that stressful state, like a race or a car accident,
Mm-hmm.
then they go do that. It's that added stress breaks them,
Right.
right?
Yeah.
They don't have resiliency at all.
No, their bucket is already overflowing and there's nowhere else to put it. And
Yeah.
so your body goes into this fight or flight survival mode, and the immune system is on fire watch, trying to put out all the fires, and they can even just be perceived fires, and that goes into that limbic system, and not getting into like rational thoughts, and we get kids that are unable to pay attention because their brains are just like, I gotta figure out how to be in my body, because there's nowhere to settle, and figure it out, because it's survival mode. And it's a really sad thing that kids are being born into that fight or flight state because our moms are not as healthy as they could be. So we have to change the tide of how our healthcare is going, is really, looking at preconception care. And that starts in childhood. We've got to look 20 years before a woman gets pregnant and make sure that her body is functioning optimally so that her future children are born into a peaceful environment and a place where they're set up for optimal health. I mean, these kids are being born under stress, and you know a mom with thyroid issues or hormone issues, and there's so many miscarriages, and it's so hard for people to get pregnant now, and our babies are being born into that stress state. And there's some cool research about stress hormones and crossing the placentas, and we know that those stressors on a mother's body affect how babies are developing and being born into this world. So to change that tide, we have to start with our children now, so that the next generation can be born into health.
Yeah, no, and I see it too all the time. I see a lot of moms that'll come to me because, they've suffered multiple miscarriages, and then they've tried in vitro, and then they've tried literally everything, but they haven't tried nutrifying their body. They also haven't tried aligning the communication in their body, through chiropractic care. And then they force these pregnancies. And then we see the babies that are born with heart defects, holes in their hearts. They're born with these, huge, massive learning disabilities. They're born, and the kids are amazing, right? Like, it's not to say that these kids are not amazing, but wouldn't you want to give your kid the best foundation in which to come into this world? And so if a mother is already depleted in nutrients, she's, that pregnancy is going to be tough. And then the birth is going to be tough. And then that child, it's going to be tough raising a child that has all these additional, um, you know, these additional conditions that we constantly have to deal with. And versus, and like you said, it is looking 20 years before, or even 10 years before, or 5 years before, to get your body in optimal health before you consider conceiving a child. But I mean, doctors tell women all the time, you're fine, you can be on Synthroid and you go on and have, healthy baby. And yes, some women can, but you could also do it another way.
Yeah. And the stress aspect of our babies are just already stressed out when they're born, and it takes a lot of work. They're more prone for the colic and the reflux and the eczemas and the allergies, and their load is already huge. And if we can start feeding our body good food, taking away the load of the processed food, the high fructose corn syrups, and the junk, and eat real food, it that takes away a lot of the toxic stress balls that we have in our buckets, and it allows babies and children and adults to have a more optimally functioning life, an easier way of life, and more fulfilling and happier and joyful and everything. And it's really exciting that I get to be a part of that, that change.
That is really, really exciting. One of the other things you just reminded me of a child. I remember this from a story from one of my chiropractors, and I have two chiropractors. So I have a chiropractor that's a pediatric chiropractor for my kids, but I can also go see her because she treats adults, but it's who I bring my children to. And she lives 15 minutes from our house. So I can book an appointment. No, I'll get in the next couple days, versus I have a chiropractor in the city, which the city for me is 2 hours away. And so this is where I'm like, okay, I'm going to commit. But the reason I work with him is because I've been working with him since I was 21. And,
Mm-hmm.
and I said to him the other day, I said, God, how much money have I just, given to you, Terry? Like, we have medical coverage, but I'm like, how many appointments? Come on. And plus I send all these people to you as well. And he's like, Nikki, in 21 years or however many years it's been that I've been seeing him, I've seen him 13 times. And that's it. And I was like, 13 times? Like, it always feels like I'm, traveling to see you. And he's like, no, Nikki. He's like, I treated you before you got pregnant, when you were pregnant, and just after you gave birth. And so that was 9 times because I've had 3 kids. And I was like, oh yeah, that's right. But he was so powerful in what he did because I had a displaced pelvic bone after my 3rd pregnancy. So I couldn't walk. And the doctors told me I'd have to be in a wheelchair. The physio told me I'd have to wear a brace and be in a wheelchair. Like, nobody wanted to even touch me because it was so excruciating, the pain. And they didn't know what to do, and they weren't sure. And they're like, we need to send you for x-rays to see if you broke your pelvis. Well, I was like, on the 5th day, I said to my husband, get me in the car, even though I can't walk. So he had to like maneuver me into the car with my like 5-day-old baby, drive me down to the city for 2 hours, and in one adjustment I could lift my knees up to my chest, and I felt like I wanted to go for a run, and I was totally fine. He was able to just reach in, touch my pelvis, and be like, yeah, your pelvis is the right side is facing forward, the left side is facing back. He's like, of course this is going to cause you excruciating pain. And he just adjusted, right? So for people out there who think like you need to go 3 times a week, it doesn't necessarily have to be like that. But this is the other part of that story, is now that my body is amazing, because I actually committed to seeing him, I think I said even just once a month, because he's 2 hours away. So once a month. And not because I have anything wrong. I'm actually going to because my body is amazing. And I said, get me ready for this race that I want to do. And I've never been preemptive like that before. And so he's like, really? You have nothing wrong in your body? And I was like, not at all. He's like, get on the table. So as he's on the table, he like touches a spot on my leg. And I'm like, ow, what is that? He's like, Nikki, your hamstring on your right side is like so tight. But I didn't know that. Like, the pain wasn't there. But if I had actually gone out and done the race with that hamstring that tight, there's a high probability I would have suffered an injury. So he was able to identify, like, you can come to me like prophylactically, is that even a word? As a prophylactic?
Yeah. Prophylactic. Yeah.
And to treat the condition, or you can come to me preemptively and actually, let's just get your body in optimal health, which is what I try and tell my clients with nutrition. I'm like, let's do the nutrition now before the disease sets in, but everybody comes to me once the disease sets in, right? So, but now it's been amazing working with him, because all these things where I thought my body was awesome, I realized actually I do have all these areas that can be improved. And what's happened from that is I am sleeping like a baby. I am able to run further and faster. And I never thought that. And he's like, oh yeah, when he works with his athletic teams, this is what he does for them. Like, they don't have injuries, but he's working with them to get them to actually perform better.
Yeah.
So you can also use chiropractic care that way as well, which is what I love.
Yeah, that wellness care, is really cool, because the body will go through compensations and changes that don't necessarily have pain associated with it. And as a chiropractor, we're trained to look at those biomechanics and those little shifts in movement and address it before it becomes a huge problem. And for example, my kids are all really healthy, and they do go to school and play with friends and go to play dates, and they're exposed to a lot, and they don't get sick as often as other kids. And if they do have an illness, it's short-lived. And they get over it so fast. And one of my daughters, I I didn't take her in to get tested, but I'm pretty sure she probably had the flu. And, you know, we stayed at home. She got adjusted. She got some herbs and lots of good nutrition and water, bone broth, and just all these, you know, good nourishing things, lots of sleep and cuddles. And
Yeah.
um, no one else in the household got it. And she only had it for a few days, and we let the fever do what the fever was supposed to do, and it she came through it just fine, and it wasn't this big health crisis for her. And you know, there have been times where um we've needed our pediatrician, and of course, and
Yeah.
we just had our well visit with them, and you know, she had not been to the doctor in the last 2 years for anything other than a well check to make sure her body is growing and functioning how it's supposed to be. And my 3-year-old, my boy, just had his first sick visit of his entire life this past November, um, at 3 years old. And his twin sister has never had a sick visit.
Yeah.
We go in and we you know, we consult with the medical doctor just to, for my mommy heart, I like someone else to tell me my kids are
Yeah.
good too. But they get their adjustments, they get their supplements to support their immune system and their gut health, and they eat well. I mean, they're still kids, and they're gonna have a piece of candy here or there, you know, but it's all in moderation, and their body can handle it, you know.
Exactly.
Um, and it's just it's crazy to look on the outside and see all these other families that are just constantly sick and constantly on antibiotics, and it's like, what is so different
Yeah.
that that's their journey. And that's a hard journey to,
Mm-hmm.
to be on. And you know, adding in um a good nutrition and good supplements and an adjustment, that's really the basis of, you know, wellness care that I do in my office, is like, let's just give your body what it needs and see where it takes you. And a lot of times these really sick kids will go months without having to go back to their doctor for an ear infection, and it's a really profound impact on their kids' lives, the parents' lives, and just everyone around them. They're living a better life because they're not having to battle these illnesses and sicknesses and autoimmune issues as
Yeah.
often. Yeah.
Yeah, I like the point that you bring up about the being sick. So there's 2 points there, one around the fever and then one about I remember when my daughter was sick once, and it's the same thing with my kids. Like they actually, their illnesses are short-lived. So they actually, where everybody else in our town, the illness is like 2 weeks long before people are feeling better. Usually for my kids, it's 2 to 3 days, or for my husband and I, it's 2 to 3 days. And we do the exact same thing that you do. Pull out the supplements, use them in therapeutic form. We pull out the herbs because that's medicine.
Mhm.
We do the cuddles and the sleep and don't send them to school when they're sick. And we always do a chiropractic adjustment. Now, here's the reason why I do the chiropractic adjustment when they have a cold. And it's because I remember my chiropractor said, hey, if you notice that their face is pale and their circulation isn't looking good and their chest isn't great, bring them in, because he can do an adjustment that increases a white blood cell count. And so he did this adjustment, and sure enough, like, I remember my daughter's face all of a sudden just turning rosy pink, like within like minutes after this adjustment. I was like, what? And she was like, oh, I feel like she just literally, like, her energy shifted.
Like that.
Yeah, it was amazing. And I'm like, is that literally, did that just happen? And is that something that you learned as well?
Yeah, I see that a lot. Sometimes, you know, we'll have kids that come in and they're just not feeling the best. And they'll come in and have an adjustment, and they go home and the mom calls me and they're like, my kid threw up in the car on the way home, or they spiked a fever that afternoon. And I was like, awesome. Like
Awesome.
their body was fighting something off, and it just needed an alignment to let the nervous system and the immune system work together to
Yes.
process whatever they were up against. And I tell parents, when kids come in with a specific issue and we care for that issue and it's resolved, all my patients know like the wellness paradigm of, bring your baby back in sooner than your scheduled wellness appointment if they're having any trouble with eating
Yeah.
or sleeping or pooping, or if they're ill, or if their attitude is just off and they're just not your happy, fun-loving kid. So eat, sleep, poop, illness, and attitude are my big five of those are things. If you're having an issue with your kid or even yourself, an adjustment can do wonders for you.
It's so true. It's so true. I love the part that you brought up about the fever as well, because, from the way I'm listening to you say it and seeing you, because for other people who are not watching the YouTube video, I mean, you're going to just hear this on the podcast, but, I saw your eyes light up of like the fever triggered. And I
Yes.
love that as well, because I'm going to assume that when your kids have a fever, you don't try and suppress it.
Correct.
Yeah.
Yeah. A fever is really good. So a fever's action is it heats up the body, and that allows calcium to be released from your bones. And that's why you feel achy when you have a fever, is because you're heating up your bones to let the calcium release, and the calcium helps boost those immune cells that are going around your body and fighting off the infection. It's kind of they're going in and getting their armor on from your bones and to go fight that infection. So fevers are really good. Of course, you want to, monitor a fever and things like that. But a 102, 103 fever is really beneficial for your body. And you support it with, a warm bath and cuddles and, things like that can help with that kind of achy and just feeling yucky with a fever. But it's a sign that your immune system is doing what it's supposed to do.
Yeah. Yeah. We do the same thing as well with our kids, is that, we don't give Tylenol. We don't give anything like that when they have a fever. And I mean, I remember just recently, why did I have to? My husband had pulled out his back very badly, like had a pinched nerve and he couldn't move for 5 days. And even our chiropractor was like, when you're inflamed like this, we got to let it settle down before we really get in there to do anything. And so in that time when he was settling, I had to go buy him some Tylenol. And it was funny because I went to the cupboard and I was like, oh, we have a bottle of Tylenol here, but it had never been opened and it was 10 years old. And so like, that's how little Tylenol we've taken in our entire life. And so, and it was interesting because for me, I was like, oh, because I know the effects of too much Tylenol, it damages your liver. Now that is, the warning that's going out to, parents everywhere, where it used to be like, just give your kid Tylenol. And if they cry, give them Tylenol. If they can't sleep, give them Tylenol. And it's not like that. Like Tylenol is like the new smoking. We know that now, that, you don't want to give that to your kids. And so we're the same way. We let that fever play out and we monitor it, obviously, if they become super lethargic and if it's going, but that's different versus that fever is needed to fight the infection. So if you suppress it, that's why your sickness ends up lasting longer, because your body needs to go in and out of these waves of fever, because all of a sudden the virus takes over or the bacteria. And then all of a sudden, you're suppressing it again with Tylenol, and then all of a sudden the fever and the virus needs to take over again. Like it's just this terrible long cycle. Whereas if you just let the fever do its work, you'll see that you'll have a shortened illness span.
Right.
Yeah.
Yeah.
There was another piece that you mentioned. Oh, the other thing that you reminded me of, just a really great story just for parents who are out there, because we've talked about using chiropractic care for, acid reflux, for projectile vomiting, for colic, for sleep, for peeing and pooing, all of those things, for gut health as well. But there's one thing, and you talked about it for, you work with the dentist, but I remember my chiropractor telling me a story about this kid that was, I think, about 8 or 9 years old, and the child had been deaf their whole life. And, child couldn't hear. So somebody had suggested, hey, take him to a chiropractor. And the parents did. And this chiropractor worked on the child just for a lot of other things, I guess, that they're working on for jaw alignment. And she did this maneuver where she did the adjustment from inside his mouth and towards his
Mhm.
ear canal, and she did an adjustment. Anyway, after one of these appointments, the kids in the backseat of the car and the parents are in the front talking, and normally the child couldn't hear, so the parents are talking about stuff, and then all of a sudden the kid goes and joins the conversation, can hear
Yeah.
completely. And now that child has like perfect hearing. And to think all
Right.
of those years that that child didn't get to hear, and that it was just that they needed an adjustment.
Yeah. Yeah.
Yeah.
And the story of like the first chiropractic adjustment is a man who was deaf and
Oh,
hearing was restored. So that's
oh
really cool.
wow.
That's like the big story we hear in our chiropractic history classes and philosophy classes is that adjustment restored that function
Oh,
of the
I
body.
had no idea. That is
Yeah.
amazing. That just gave me goosebumps. Ah, I love it. I love it. Um, so with parent, so one question that we definitely need to answer, and because I hear this, I even hear it sometimes from my kids where they say to me like, "Oh, but I feel so terrible after that adjustment. I don't want to go back." So tell me about that, because you and I feel it too. There's, and my chiropractor always lets me know, like, drink lots of water, get lots of rest after you get treated. Tell us why that's happening and what people need to know about that.
Yeah. So when those joints aren't moving, your body's going to try to protect it. And you're going to have inflammatory factors and cytokines and things like that kind of surround that joint to try to protect it. Your muscles are going to get tight to, again, protect that joint. And the adjustment's going to come in there and kind of have a shock factor and restore that movement. And sometimes our bodies are like, whoa, what happened? And so they'll flood that area with a little bit more inflammatory factors to help dissipate the fibrous, things that are laid out. And it's good to definitely like drink some water, maybe take an Epsom salt bath to help your body with that detoxification to get that area that was so compensated with tightness to like flush it out. And so right after an adjustment, sometimes you are a little achy and you're like, oh man, what was that? But it's just your body like being like, oh, what has happened? I've been stuck in that position so long. That was my new normal. And now I'm back to the old normal, the where it's supposed to be. And your body has like a little freak out moment. Um, but you just need to help it kind of flush out and detox that area as well. Yeah, and sometimes people get adjusted and like their pain just totally goes away. Sometimes our bodies want to kind of help go back and be like, no, 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 I like it all tight and compact and locked up, and so it'll try to bring it back there. And so sometimes it takes a couple of adjustments for your body to kind of realize that the movement that we restore is what's supposed to happen.
Yeah.
And so, you can be sore after a few adjustments, but like your chiropractor, lots of water, Epsom salt baths are really great to just help your body, help with that detox and kind of chill everything out. It's really good.
Exactly. Exactly. And using an ice pack or a heat pack, depending
Right.
on which mode makes it feel better,
Yeah.
all these different things. And it's not that it requires, for the most part, I mean, in all the times that I've ever worked with chiropractors and my kids have, they generally don't need very much. And very few times they're like, oh yeah, depending on what the adjustment is, they can feel that. And it is treated by water and rest. And like you said, the Epsom salt bath. With the oh my gosh, I didn't write it down, and that's a problem when I don't write things down because I'm so excited about the conversation. I want to listen to everything you're saying and not have to plan ahead for the next question. But um, with chiropractic care, um, how do people know if somebody's a good chiropractor versus a not good chiropractor? Because I've had people say, comment on that before.
Um, let's see here. I always tell people as a pediatric chiropractor, I am very specific in what training I have. And I, you know, modify my adjustments to meet the kid where they're at. And I have lots of different techniques I can use specific for children. Um, in school we get a little bit of pediatric training, but it's not our focus, of
Mm-hmm.
course. So for me, when people are like, how do you know someone's knows pediatric training, where there's several um, uh, training modalities out there for pediatrics. One's the International Chiropractic Pediatric Association, who I've been certified through. There's the International Chiropractic Association has another pediatric certified program. And so if you're looking for a pediatric specific chiropractor, you want to look for someone that's had additional training, because kids aren't just little bodies. Their biomechanics are different, and we need to change how we treat them. That you can't just do the same adjustment that you do on an adult on a kid. It's a little different, and it really, getting to like meeting the kids where they are, and knowing how much pressure to use for an infant versus a 13-year-old, and things like that. For other things, like, like medical doctors, there's lots of different specialties out there. And so really, evaluating yourself and like what your goals are with chiropractic care may help determine what type of chiropractor you're going to see, and your comfort level with different modalities of adjustments. Like, do you want a hands-on adjustment versus an instrument assisted adjustment, or there's other like myofascial type adjustments where we're just working on the fascia and stuff like that. So you really have to kind of check out who you're going to, and what their training's been in. And yeah, and one of the other things is your chiropractor someone who's going to not have you on just like a protocol that everyone's on for
Yeah.
a care plan? Like those 3 times a week for 3 weeks and 2 times a week for 12 weeks, like those things that everyone's on the same kind of care plan. Every body and every person is on their own journey,
Mm-hmm.
and needs care specific to their journey. And so not everybody needs to be adjusted 3 times a week forever.
Yeah.
So those are my things. Are like really look to what they're specialized in, what kind of modalities they use, if that lines up with your preferences, and then having someone that'll really listen and create a care plan for you that's specific for you.
I love that, because what you just said applies to any health practitioner that you're going to
Any health
see.
practitioner,
Yeah.
right?
And I love
Yep.
when my clients come to me and they say, oh, I've been working with this practitioner for 12 years, but I still have the same issues going on. And
Yeah.
that's when I say, well, maybe you need a different practitioner in the same field, or maybe you need a different practitioner in another field to help you with whatever it is you're going through. And so everything you said applies to absolutely everybody. And it's important to know that, just like, no 2 yoga teachers are going to be the same. Like, I've heard people say, oh, I'm never going to yoga again because I didn't like that class. And I'm like, but there's like like probably now 100 different types of yoga styles to choose from, just like there's 100 different types of art styles to choose from. If you want to be an artist, not everybody needs to be a painter. You can be a dancer and a sculptor and a singer. And it's the same thing with your health practitioner as well. The other thing that I would add that I usually tell my clients is, work with the person who's going to get you the results you're after. So if whatever you're like, and you did mention that, like, what are your goals?
Yeah.
Right. So make sure you're achieving those goals. And that's really, really important. And inquire as to why you maybe are not achieving those goals. And maybe it's a mix of, you need the nutrition with the chiropractic care, or you maybe need whatever it is, weightlifting with chiropractic care. Those two often go, really well together as well. Using the right technique at the right time is really important. I do love this about my chiropractor because, for I mean, he only, for the first time ever, I said to him, go ahead and you can adjust my neck. And he was like, thank God, Nikki. He's like, because the other techniques he was using for my neck still got me results, but they took longer
Mhm.
versus just simply doing the adjustment. But I wasn't comfortable with it. And he was fine with that. So
Yeah.
and he had all this additional training, like he would use, active release technique on my neck, which is awesome. It doesn't require any adjustment. And so I love the fact that he was always getting training as well, as something that
Right.
I think is really important,
Mhm.
because science in any field is always evolving,
For sure.
which is great. And that using the right technique at the right time that you're comfortable with is really good. So my kids, I teach my kids I teach this to my kids, and I love hearing them communicate with our chiropractors, because they'll be like, oh yeah, I don't want that, but could you use this instead? And so
Yep.
they're not just like handing their body over, they're actually part of the treatment process and the decision.
Exactly.
Yeah.
Yeah, and that's how it goes in my room a lot, sometimes we adjust babies laying on a pillow on the table. Sometimes those babies are nursing. Sometimes those babies are, we're moms dancing in the room swaying and I'm swaying along with them. And sometimes, with older kids, I see a lot of kids on the spectrum, and sometimes I have to meet them where they're at with low lights, and we're sitting behind the chair on the floor in the corner, and we just work together that way. I adjusted a kid yesterday under my table because that's where he was most comfortable, and
Right.
I'm not going to force him to lay down flat on my table so I can do my job. um, my job is to meet them where they're at and give them the care that their body needs. um, and they help dictate what that care is, and all the kids that come in know that they can tell me, and they're like, Dr. Brandi, I don't want that today. I'm like, that's cool, can we try this or not? It's having that body autonomy is really important too, and being able to teach kids that they are part of their own health journey is really important. And it's really cool to have kids come in and they're like, Dr. Brandi, I fell on my butt and I can't poop. And I'm like, all right, let's fix that. So
Amazing.
it's really, really cool to be a part of that.
I love that. I love that. And we need more people understanding, like to listen to this podcast and understand how incredibly potent, chiropractic care is. I know that, you're a pediatric chiropractor. But for moms as well, what's really important to know is that use a chiropractor before you get pregnant, while you're pregnant, because they have amazing pillows that go underneath your belly, and they can drop the middle of the table down so that your belly fits in. And I mean, I loved going for chiropractic care while I was pregnant, because then I didn't have to live with the back pain and if you have sciatic pain and, things like that. But
Your body changes while you're pregnant and your biomechanics change. You got more relaxin hormones, so your joints are all getting all loosey goosey. And chiropractor is just going to help make sure all of that's moving like it's supposed to, aligned like it is, and hopefully help birth be easy and easier and comfortable, and as much as it can be,
exactly, exactly. I like that you are like, her birth be easy, easier. I mean, yeah.
It's hard work. No matter how it happens, it's hard work.
Yeah,
So
but
yeah.
being aligned, right? Because one of the things that when I was birthing, I loved it that in my second birth, I had an orgasm. In my first, or actually all three births, I felt this hucking sensation, like somebody was trying to huck up my uterus, was trying to huck a football out of me. And when I explain that to people, not everybody got to feel that. And I really attribute the fact that I got to feel so many incredible things while I was birthing, because my body was in alignment and I wasn't dealing with all this other pain that's happening. And
Right.
so going into birth with your body fully aligned, I was so relaxed, and my body was just like, I could feel it doing these incredible things on their own. And I know that your body is designed to birth a baby, because
Right.
when I being completely relaxed, I got to feel my uterus try and shove the baby out of me without me even having to push. Like, it was the
Yeah.
very coolest thing.
Yeah.
But if your body doesn't have that communication and signaling happening, then the brain can't tell the uterus what to do, and the uterus can't tell the brain what it needs. And so
Yeah.
Yeah, which is really important. The other piece is after you give birth, for a lot of women who have trouble breastfeeding, it can literally be that they need a chiropractic adjustment.
Yeah.
Yeah.
Yeah, I mean, if baby is having trouble nursing on one side versus the other, you know, how that baby was born, either through the birth canal or through C-section, you know, that's a lot of pressure and forces on a baby's head and neck. And um, sometimes, you know, them in different nursing positions is uncomfortable for them. And so that's one thing that we, you know, when our moms come in, you know, have babies, we're like, you come in as soon as you can if you're having any trouble nursing,
Yeah.
because we can correct that subluxation and hopefully get a baby on a better, easier nursing um, journey. And, you know, I contribute chiropractic care with my pregnancies, you know, being able to work as a chiropractor, carry twins twice, and have healthy, you know, vaginal births with, you know, my twins. And each set of twins, I had a breech baby. And that's just how my body has babies, and that's how my babies are born. Is my first baby always comes out booty first. And you know, I struggled to find the right care team that would support my body and how I was having my kids. And you know, chiropractic care kept my pelvis aligned and my ligaments nice and loose, and allowed my body to move like it was supposed to in labor, to be able to birth those babies that a lot of people would automatically go for a C-section. And you know, I was able to carry my twins further along, and they did not need to go to the NICU. And you know, being a twin mom, I'm in that community, and so many babies are born early and go to the NICU, and it's a hard start for them. And I didn't have that experience. And I think a lot of it has to do with having a healthy pregnancy, with what I put into my body, how I moved my body, and chiropractic care.
Yeah, no, definitely. And my midwife who's birthed, I think she's birthed over 10,000 babies now in her 40, 50-year career. And, you know, she said the same thing as well. She sees it all the time when women nutrify themselves, when they are getting the proper treatment for their body before, during, and after. She says she witnesses those births. She's there every single time, and
Yeah.
she sees it, you know, day in and day out. And I mean, I wish she'd write a book, because she could probably, or do some data collection on all those births. But it would really be, you know, incredible to see the studies that come from that, from women who do receive, which I'm sure there probably are studies, but to see that women who are nutrifying themselves well with that chiropractic care and alignment, like what that can mean from them. And my chiropractor, he specializes in postnatal care as well for women, and he has women who cannot breastfeed; their milk will not come in
Yeah.
at all, and he does an adjustment on them, and on his table the milk will just like saturate their shirts when
Yeah.
the milk hasn't come in for like days and days and days and weeks, and he's able to restore that function, whereas the doctor's just saying, sorry, you know, put the kid on formula because, you know, you just can't breastfeed.
Yeah. A
Right.
lot of chiropractors say, you know, we turn that power on, and
Yeah.
that power that made the body heals the body. And sometimes we just need to flip that switch, and
Yeah.
power of an adjustment.
It's amazing.
Yeah.
So, Brandi, we're going to wrap this up, and but I would love to know. Well, you're in Kansas, first of all, so everybody who's listening to this, please know that Brandi is in Kansas at the. Is it a line?
Align. Yep.
Yep, a line clinic, a line center, a
It's
line.
a line chiropractic for the whole family. So
Amazing.
yeah.
And you have a whole team of practitioners there,
Yeah, we
chiropractic.
have there's two other chiropractors here, and they work with adults. I'm the only one that specializes in kids. One of our other doctors will see some kids as well. We treat the whole family here, but I have chosen to really focus mine for pediatric care. So
Amazing. And that's at myalign.com, right?
correct.
Where
Yep.
people can reach you. And then for anybody else who's anywhere in the world, because I know we have global listeners here for this podcast, but one way to get a really good chiropractor is to ask around. Ask your friends who've had really good experiences with a chiropractor and just get a referral from them. You
Yep.
can also get a referral, hopefully, from a doctor if you know one. Don't let a doctor discourage you from seeing a chiropractor as well, because I've heard of doctors doing that, like, oh, don't do that. You don't need that. That won't help with your condition. Whereas be open to it and just go try, because if you've been suffering with anything for a long period of time, getting your spine aligned, your body aligned, your entire system aligned gets you one step closer to getting results. If not, it's the result. It'll be what gets you the result that you want. And what else would you like parents to know, families to know about chiropractic care? This is your chance to,
Oh
if
man.
you had one wish, what would it be
Oh
for
man.
all families?
It's, it's so fulfilling to be part of these families' team. And being able to follow these families from preconception through their prenatal period, through birth, and watch these kids be born and grow up. And now I'm seeing some of the kids that I started practicing, like going to high school and driving a car. And it's just, it's incredible to see their journeys, and know that they're on a path of wellness and health. And just some of the changes are so profound in some of these kids, and parents have not been listened to by other practitioners, and it just breaks my heart. But then they come here, and being able to offer hope that there is something that we can do and help them, guide them to find the right practitioner, is just really incredible. And I'm so fortunate that I get to do this work. And I tell people, I go to work and I get to play every day. And
Yeah.
I get stickers too, and high fives, and we dance, and we have a good time here, because that happy sensory information is really good for your brain too. So it's just a really incredible thing that I get to be a part of, and I love it. So
That's amazing. I love, love, love that. So we'll have Brandi's contact information in the show notes so that you can refer back to her website if you are in the Kansas area. And then we'll be putting some links to other practitioners as well, just for other areas where we've heard of really good chiropractors. So, and ask around, everybody. You got to go out and get this treatment if you've never had it before, and maybe just book another appointment now with your doctor, your chiropractor, so that you can go and just get health happening for you. It's the most important thing we can do for our body, because health truly is wealth and happiness. So thanks, Brandi, for being on our show. It has been such a pleasure. Thanks for sharing your expertise and knowledge with us.
Thank you so much. Thank you.
Okay, bye, everyone. So I hope you enjoyed that show. It has been a pleasure having you here on this podcast, listening to Dr. Brandi Benson. If you have any questions, reach out to her, reach out to myself. I have loved having you here. And if there's any guests out there that you'd love to have, that you'd love for me to interview on this show, please email us at info@richerhealth.ca or Nicolette@richerhealth.ca, and we'd love to reach out to them and get them on our show as well. So thanks for sharing everything that we do here. Thanks for really living a good, solid life that is full of evidence-based science, and not all the gobbledygook that really is flooding our internet in this crazy COVID times. So do your research, implement, learn from what you're doing, and as always, share the information with others. Thanks for being here, everyone. Bye for now.